everybody. Just wanted to give you your Monday, July 27th coronavirus update. Lots of stuff has happened over the weekend on the coronavirus front. But let's get right into the facts. This is directly from the CDC website. Have been, I should say, 4,163,892 cases. And compared to yesterday's data, there are 64,582 new cases in the US. There have been 145,982 deaths due to the coronavirus, and compared to yesterday, there were 969 new deaths. It does look like the hot spots are still on the coast, New York, New Jersey, Pennsylvania, Florida, California, Illinois, because of Chicago, and Michigan. So basically, where most of our major cities are, our major kind of international hub type cities, international gateways. There was an overall, about I'd have to give you I can't do the estimate right now, but I'm just looking at a chart here, and it looks like about a 20,000 new case drop between today and yesterday, which is pretty good. That is actually a big drop. So, perhaps some of our, maybe it's just a fluke, but perhaps some of our, efforts, wearing masks and, social distancing and that sort of stuff is starting to catch on again. I think we all became a little complacent. In other news, there is Moderna, the drug company, is starting on a phase 3 trial here in the U.S. So about 30,000 volunteers will receive a possible or a potential a vaccine that is in testing. So phase 3 is pretty far along the line. So it means we've got some stuff happening. We have the one in the UK. We have I don't know if this is the same one, but it is sponsored by the National Institutes of Health. So it does have a pretty good chance, I think. There are around 25 vaccines in clinical trials around the world. So many advancements are happening very quickly because this affects so much of the world. It's not just a U.S. problem. So there's that. One thing that has kind of come up over the weekend, Dr. Deborah Birx has been kind of touring the country, going state to state. She was here in Ohio on, I believe, Saturday, and she's just kind of urging folks, to do things like close restaurants a little early. The White House recommended that Ohio, specifically among other states, to close restaurants and bars earlier, say 11 p.m. rather than the normal 2-3 a.m. to help slow the spread. When folks are drinking, they're not going to be as cognitive when they're heavily drinking, I should say. They're not going to be thinking about social distancing and wearing masks and things like that. So it just helps to slow the spread. There was a letter kind of posted on the U.S. Public Interest Research Group's website by a lot of physician leaders, medical professionals in our country. It was over the weekend, and they would really like to see another shutdown happen. Whether or not I think it's possible, but I don't know that another shutdown is going to happen anytime soon. I think it would have to get really, really bad for that to happen because it had some very drastic effects on our economy. But in this letter, they said, quote, "Non-essential businesses should be closed. Restaurant service should be limited to takeout. People should stay home, going out only to get food or medicine and exercise and get fresh air. Masks should be mandatory in all situations, indoor and outdoors, where we interact with others. We need that protocol in place until case numbers recede to a level at which we have the capacity to effectively test and trace. Then, and only then, we can try a little more opening, one small step at a time." You should bar non-essential interstate travel. When people travel freely between states, the good numbers in one state can go bad quickly. If you don't take these actions, the consequences will be measured in widespread suffering and death. So it is kind of an ominous thought from people who certainly understand, medicine and understand what's happening. Will it happen? I don't know. I mean, I think a shutdown, if you're just focusing on the coronavirus and not the economy as a whole, or the world as a whole, a shutdown would certainly help. And ideally, if we could shut down and just keep everyone inside their houses for a month or a month and a half. People say 2 weeks, but the thing is, if you have family members in your house that could you could pass it around, and then you have another 2 weeks, and so I think a month and a half, if we could just do that, it would pretty well cut out most of the coronavirus cases. But we live in the real world. That's not going to happen. So, will another shutdown happen? I don't know. I don't think anybody does, but it's interesting to see these groups starting to come out, and it seems like the White House is starting to catch on that maybe something needs to happen more, because the cases are getting a little more out of control. So I don't know. Let's see what happens this week. I think it's going to get probably worse. I think things are going to continue to get worse for the next few months. But with that, I really don't know where things are going to go. And, politicians are about as predictable as, anything. They're just unpredictable. But who knows what's going to happen. But I wish you all the best and wish you good health. And I'll talk to you tomorrow. Bye-bye.
All right, so our fried chicken is finished. I just pulled it out of the deep fryer a few minutes ago. Well, the second batch, I should say. And I'm about ready to give it a try. But before I do, I just wanted to mention, I forgot in the last part of the video, that you need to leave it in the deep fryer at 375 for about 15 minutes. If you want to be really safe, you can use a meat thermometer, and you want to reach an internal temperature of 175. So yeah, I just wanted to mention that. But all right, let's try a piece. Oh. The skin has a wonderfully strong flavor. You can taste the garlic and the onion powder so much. Not overpowering, just enough. Excellent. All right, that's it for this episode. If you have any questions, comments, or anything at all, just leave it down at the bottom. And until next time, enjoy. Goodbye.